Hello and welcome to the virtual Own Your Arthritis presentation. This presentation was created for patients of the Edmonton Bone and Joint Center leading up to their surgical screening visit. Due to the COVID-19 pandemic, in-person classes have been suspended. This short video has been developed in its place. Please watch this before your screening appointment. First, a bit of information about your hips and your knees. The knee is a hinge joint, whereas the hip is a ball and socket joint. Osteoarthritis affects all parts of the joint, including ligaments, the joint lining and capsule, fibrous cartilage like the meniscus in the knee, as well as the articular cartilage covering the ends of the bones. When the articular cartilage becomes severely affected, we may start to get pain and stiffness. These are the most common symptoms of an arthritic joint. You can think about the bones in a joint like the end of a chicken bone. That nice white end of the bone is cartilage. As osteoarthritis progresses, there will be increased degeneration of the cartilage on the ends of the bones. Not everyone will experience this the same way. Some may have a lot of pain and/or stiffness, while others report less pain and stiffness with a similar level of disease and continue to function quite well. At this time, we have no treatment to repair or replace damaged cartilage. Because we cannot cure osteoarthritis, treatment revolves around reducing symptoms and maintaining the remaining cartilage. Even if you've been told that you have bone-on-bone arthritis, there may still be some cartilage to maintain. X-rays don't necessarily correspond with symptoms or with function. We can see cases of early arthritis that result in significant pain. Conversely, we find cases of significant arthritis on X-ray that don't cause undue symptoms or functional problems. Symptom control can vary greatly, usually with very little objective change seen on an X-ray. When symptoms are being well managed at any stage of arthritis, surgery may not be necessary. Before we get too far along here, let's debunk a common myth. Many people think that using your arthritic joint will cause more damage. However, one of the single best things you can do to manage your arthritis symptoms is to gradually increase your activity and exercise to strengthen the muscles around the joint. The trick is to find the right starting point and appropriate progression that doesn't increase pain past a tolerable level. Being sedentary weakens your muscles and reduces nutrition to the cartilage, which can cause the arthritis to progress. Weight-bearing exercise and activity is necessary to maintain the health of bones and joints. When you start to exercise or increase activity levels, you will have pain. Pain happens as a result of the inflammation that occurs when there is poor control of an arthritic joint. Building strength and control around a joint will help build tolerance to activity and can actually help you manage pain in the long run. Use the supports in your toolbox, which we'll cover shortly, to increase your mobility and stamina. Now onto your toolkit for arthritis pain. Like we've mentioned, one of the most common concerns with arthritis is the pain associated with it. Today, we'll discuss some of the many ways of managing painful joints to allow you to do more and go further. You can try different methods over time to see which are most beneficial for you. Physiotherapy, exercise and activity, thermal agents, both hot and cold, bracing, walking aids, and medication are the usual starting points in arthritis care. The expectation is that you have tried a number of these options prior to talking to a surgeon. When these options no longer help you manage your arthritis symptoms adequately, then your last resort may be to be assessed as a candidate for surgery. While physiotherapy may be a great option for the initial treatment of your arthritic pain, it will also play a role in your screening appointment. When you come into our clinic for this appointment, the physiotherapist will create a treatment plan, which should include supervised exercises in the clinic and a home exercise program. They will teach you how to progress your exercises as you get stronger, and may also offer a variety of passive treatments which may help temporarily with pain or flare-ups. Your physiotherapist can also answer questions you may have about your arthritis and suggest reasonable types of activity. GLAD, or GLAD, is a small group education and exercise program lasting 7 weeks. This class teaches you the most appropriate exercises to treat the symptoms of hip and knee arthritis. Here, you'll learn good technique and exercise progression, as well as create a plan for how you'll continue the exercises once the program is finished. You can check online at GLAD Canada for more information. The link will be included in the bio. Exercise. Exercise is a physical activity that is performed repetitively for a set time with a goal in mind and with proper technique and posture. Some exercise targets cardiovascular fitness, some improves flexibility or strength, some targets coordination and balance. If possible, you should aim for each of these components in a fitness plan. Physiotherapists, kinesiologists, and some fitness trainers have expertise in this. Activity. Think of low-impact activities such as walking, cycling, elliptical, tai chi, or water-based exercises. Choosing an enjoyable activity will increase the probability that you'll keep at it. Use the tools in your toolkit that work best for you to allow you to do more and go further. Plan for rest periods. Break activity and exercise into chunks that are manageable. Walk 3 minutes out, 3 minutes back, and sitting down and icing what hurts is a good start compared to doing nothing. You can progress as you tolerate more. Rest periods also include being kinder to yourself throughout the day and conserving energy where possible when doing necessary tasks. This can help reduce pain at night. Aim to engage in exercise on a regular basis. Think daily. You can vary activities to keep yourself engaged. These different activities may provide you with different benefits, like balance, endurance, mobility, or strength. A common reason for not engaging in exercise is busyness. There's simply no time in the day to exercise. However, exercise can be accumulated throughout the day. Think of adding on to the activities you already do. Walk a lap around the grocery store before doing shopping, do a few flights of stairs prior to your lunch break, do your resistance or balance exercises during commercials when watching TV, or while waiting for your meal to cook. Remember, the goal is to add activity or increase upon the activities you're already performing. Gradually increase the amount of time and intensity to see greater benefits. Aim for sustainable activities that you'll be able to perform regularly, if not daily. Now on to the next item in your toolbox, thermal agents. You can use heat or cold depending on what works best for you. Hot or cold packs should be used for 20 minutes or less at any one time, but they can be reapplied multiple times throughout the day to help you manage your pain and stiffness. If you have arthritis in your knees, another tool you can use to manage your symptoms is bracing. There are many kinds of braces available. It's best to speak with your healthcare provider and try several on before making a decision. The simplest option is a knee sleeve. It may provide control for swelling and greater feeling of stability in the knee. Hinged braces tend to be bulkier and more expensive, but they can support weak tissues in the knee and can be designed to unload stress from one side of the knee to reduce pain. If you have benefits that pay for your brace, you will require a prescription from your doctor. For both hip and knee patients, walking aids are a great asset. They don't make you look weak or old. In fact, proper use of a walking aid can decrease up to 20% of the forces through your joint, reducing pain. If you limp, you could benefit from using a walking aid. An appropriate walking aid should improve your functional walking distance, make you more confident to participate in activity, and reduce your risk of falls. Walking aids include several different types of canes, many types of walkers, crutches, as well as walking poles and sticks. The next item in your toolbox is medication. Check with your physician or pharmacist about medications to manage arthritis symptoms. Over-the-counter medication, such as acetaminophen, commonly known as Tylenol, is safe for most people to take on a regular basis and can be effectively combined with anti-inflammatory medications such as ibuprofen, naproxen, diclofenac, or ketorolac. Topical anti-inflammatory medications such as diclofenac can be formulated and applied as ointment or drops on the affected area. There's also an over-the-counter version of diclofenac cream. Stronger medications, like opioids, are generally restricted to short-term use only, and would usually only be indicated during recovery from surgery. These medications become less effective over time and can result in addiction. There is limited research on the benefits of the use of supplements or cannabis to treat osteoarthritis. Injections are another useful tool for managing the symptoms of your arthritis. Injections of cortisone, which is a strong local anti-inflammatory agent, or hyaluronic acid, which is an artificial joint lubricant, can be done by some radiologists. These are the most effective in cases of mild and moderate arthritis. they generally become less effective as the arthritis becomes more severe. There's no conclusive evidence on the effectiveness of injections like stem cells or platelet-rich plasma. Another important factor in managing your arthritis symptoms is your body weight. Carrying extra weight increases the forces through your joints. For every 1 pound of weight, 4 pounds go through your joints. That means that a manageable weight loss of 10 to 15 pounds can decrease 40 to 60 pounds of pressure through your joints. Mild weight loss can often improve joint pain. There is also evidence that excess body fat creates and releases chemicals that cause inflammation. On the note of body weight, let's talk about body weight and joint surgery. BMI is a ratio of height to body weight that is one of the measures surgeons use in deciding whether you're a candidate for surgery. Excess body weight brings several risk factors for surgery, including infection, heart problems, blood clots, the need for further surgeries, and less successful results. We've mentioned a lot about excess body weight. On the flip side, some individuals may be underweight or may be unintentionally losing weight because of pain and fatigue resulting in poor appetite and intake or other health issues. Again, making healthy choices to your diet to achieve a healthy, stable weight is important for your joint health to fuel your body, feel energized to move, and heal well. Remember, when it comes to your weight, what you eat matters. Many people blame their difficulty with weight loss on their joint pain. While being active can help you manage your weight, what you consume affects your weight more than activity level, because we're not 20 anymore and we're not training for the Olympics. We have to pay attention to what we eat to lose weight. Here's a quick tip to help you achieve healthier eating. Does your plate have twice as many fruits or vegetables as grain products and meat and alternatives? In this chart, starchy vegetables refer to vegetables such as potatoes or corn. Here are several healthy eating habits you can work on. Eating breakfast every day, eating 4 to 5 times per day, avoiding drinks with calories, having 2 to 3 servings of low-fat milk or alternative milks each day, having at least one food with fiber at each meal, limiting sweets or extras to 0 to 2 times per week, limiting eating out to 0 to 2 times per week, and aiming for smaller portions and a healthy plate at every meal. You may decide to implement a few changes at a time. If you encounter difficulties with managing your nutrition, consider getting help from a registered dietitian. We've now discussed a variety of options to manage your arthritis symptoms. You can discuss options, such as meditation and acupuncture, with members of your healthcare team to see if these may be of benefit to you. You may find a combination of tools may help more than one tool on its own. If the non-surgical treatment is not enough, then we discuss surgery. Deal breakers, including smoking, sleep apnea, diabetes, anemia, outstanding dental work, and excess body weight, will affect your eligibility for joint replacement. They are non-negotiable and will be part of your medical clearance for surgery. Your family doctor can help you manage these deal breakers to make you a healthy candidate for surgery. One important thing to consider is that joint replacements are a pain reduction strategy. However, they don't bring back the hip or knee you had when you were 20. It is important to understand that joint replacement may not eliminate all the pain from the joint. If your arthritic pain wasn't significant before surgery, you may not notice a great improvement after a joint replacement. Some people still have a limp and may need to use walking aids after recovering from a joint replacement. Many people cannot squat or kneel and thus have to change some of their typical activities. Impact activities like running or jumping need to be avoided forever after joint replacement. Surgery should be a last resort. Surgery is not a surefire cure or an easy solution to your arthritis symptoms. It does not give you back all the abilities you had before your joint became arthritic. The risks of surgery are real, and although the complication rates are low, if they happen to you, they can be life-changing. You have to be sure that the pain and dysfunction you're experiencing is bad enough to be worth the risk if something happens to you. The risks of surgery will be explained by the surgeon before you consent to it. Surgical risks include infection. This can lengthen the time to recover from joint replacement. More severe complications like a deep infection or a multiple dislocating hip may mean multiple surgeries to try and control the problem. In severe cases of infection, amputation is the last resort. anesthetic risks like death, stroke, or heart attack, blood clots in the legs or in the lungs, nerve injury resulting in nerve pain or a drop foot, fracture during the time of surgery, stiffness in the case of knee replacement, dislocation in the case of hip replacement, and worsening of chronic conditions like kidney problems, heart problems, or dementia. Risks are higher in people with chronic health conditions and smokers. Age itself is not a relative risk. Post-op considerations. Average hospital stay for a joint replacement is 1 to 2 days. You will need to arrange help with driving and other activities around your house and home for around 6 weeks. People need to be consistent with a routine of appropriate exercise to regain motion and strength. Most people are offered physiotherapy treatment in their early recovery to help guide them through this process. The hard work doesn't end there. People need to continue on these exercises and activities independently once finished with physiotherapy. The majority of people recover very well after joint replacement surgery. They will be able to resume many of the low-impact activities they enjoyed previously, like golf, pickleball, spending time with their grandchildren, hiking, and swimming. Choose suitable activities as tolerated, bearing in mind that the new joint is not designed for high-impact activities like running or jumping. Thank you for taking the time to watch this video. If you have questions regarding this presentation, please call the physiotherapy line at the Edmonton Bone and Joint Center. You can reach us at 780-377-1432. If you're unable to get a hold of us, please leave a message with your name or the name of the patient you're calling for and your number, and we'll get back to you as soon as we can. Thanks again for taking the time to watch this presentation.